Provocative discussion blending science, innovation, and the human experience. Today, we're diving into some of the most critical and often overlooked topics in women's health. Joining me are three trailblazing women reshaping the conversation around menopause, beauty, and wellness. First, Dr. Jessica Shepard, board-certified OBGYN, author of Generation M, Living Well in Perimenopause and Menopause, and a media personality inspiring millions to embrace the stages of life with grace and empowerment. Next, Lana Kerr, the visionary founder of CO2 Lift and Lumisk Skincare, who's using medical-grade carboxytherapy to revolutionize skincare and vaginal health. And finally, Dr. Daisy Aim, a triple board-certified cosmetic surgeon and OBGYN, whose expertise bridges wellness, beauty, and health to create a holistic approach to women's care. We'll cover myths surrounding menopause, innovative skincare treatments, and even the mysterious condition known as frozen shoulder, often overlooked but deeply impactful. Buckle up, because this is one conversation you don't want to miss. Welcome to the show, superstars.
Hello.
Hi, everyone.
So excited to have you on. I'm going to start with you, Dr. Jessica. So menopause, let's chat menopause and misconceptions. So menopause often carries the stigma, leaving many women to basically suffer in silence. And according to the North American Menopause Society, 75% of women experience symptoms like hot flashes and night sweats, yet fewer than 20% seek treatment. So Dr. Shepard, your book, Generation M, is a rallying cry for women to reclaim their health during this transformative phase. What inspired you to write this book, and how can it help dismantle the taboos surrounding menopause?
You know, I think that my patients were the ones who finally were speaking in my head over and over years to really get the word out on what perimenopause and menopause is, because that's really a confusing time. And even though you mentioned the symptoms of hot flashes and night sweats, which are typically the most common, there are so many other symptoms. And I found that women were really trying to put the pieces of the puzzle together, and they really couldn't, or they would go to another doctor and they were kind of dismissed or not heard. So I really wanted to bring a really easy read for patients to be able to read, get some insight, but realize that menopause is not just about the pelvis and ovaries and estrogen. It's a whole body experience and transformation. And so once you realize really the impact on your entire body and mind, I think that people have an easier time going through that transition. And that's what I want them to do, because this is going to be that new chapter of your life. So I want them to be overjoyed about it rather than dreading that new chapter.
That's so empowering to hear a perspective that actually normalizes this experience, but also offers real solutions. Yeah. And I imagine many readers will feel seen and supported through this book. I know that on our panel, Dr. Daisy and both Lana have your book and always speak your praises. So congratulations on putting that together. I'm sure it was a labor of love, if you will.
It was a labor of many paper cuts. Yes.
Oh boy, yes. Lana, CO2 Lift vaginal treatment. Let's talk about that. So your treatment is a game changer, especially in an era where women are taking control of their intimate health. 2021 study in the Journal of Women's Health found that nearly 50% of postmenopausal women report symptoms of vaginal dryness or discomfort, yet many don't realize there's an effective, non-invasive treatment actually available. Can you explain how the CO2 Lift vaginal vulva treatment works, and why is it such a breakthrough for vaginal health?
I think that there are three things that we kind of focus on with the CO2 lift. You're talking about blood flow, because the clitoris needs blood flow, the tissue, the thinning tissue, as well as pH. And just to show the power of the CO2 lift carboxy, it can close a non-healing diabetic ulcer in 8 days. And you think about a diabetic, what are the issues? Circulation, so blood flow, and then regeneration of tissue. So CO2 lift, mix it together, creates CO2 gas, which tricks the body into like pushing oxygen-rich blood to the area. So it's going to address those things for a woman in a painless way, immediate, and from the privacy of their homes.
Well, it's incredible how science is catching up to meet the needs of women in such a personal and impactful way. And I can see that this has become a must-have treatment for women at any stage of their life. And Lana, you have done something very proprietary, and I love that you used your own perimenopausal and menopausal experience to cater and craft this for women out there. You're doing a real service because your product is simple and very effective. And I love that it's clinically researched and clinically verified. Now I'm going to pivot to Dr. Daisy. We're going to talk about myths of perimenopause. So, Dr. Daisy, as someone who bridges that gap between cosmetic surgery and OBGYN care, you have a quite unique vantage point on the misconceptions women face during perimenopause. One of the biggest myths is that this phase is purely hormonal, when it also impacts mental health, sleep, and even relationships. So, what are the most common myths you've encountered, and how do you help your patients navigate this complex journey?
Yeah, the most common myth is that perimenopause happen in your early 50s. As we know, it can start as your late 30s and early 40s. Myth number two, the most common symptom is hot flashes. While hot flashes everywhere, actually the other symptoms are more prevalent, as we've already mentioned, Dr. Jessica mentioned. Sleep disturbance is a big one. Irregular period is actually the most common one because that's what signifies that you're in perimenopause. Mood changes, brain fog, that also happen. Another myth is that hormonal therapy is unsafe. While education is needed on that, it's not unsafe. It can be very beneficial to the patient. So consulting your physician or your gynecologist or healthcare provider to really navigate that space with you is very important. Another myth is that in perimenopause, fertility is gone. Well, it's not completely gone. It might be slower than before, but it doesn't completely disappear. So pregnancy can still happen. So it's not as common as in your 20s, but you still can. Those are some of the common myths that I've seen here in my practice. And the way I go about approaching to my patient is really just listen to her story and help her navigate that path so that she doesn't feel like this is just unusual. It's very common. A lot of women are experiencing it and they're not really talking about it except now, which I really like that a lot.
Wow, your insights really remind me that perimenopause isn't just a physical change. It's truly what you just said, a deeply emotional and personal experience. And breaking these myths definitely makes all the difference. Uh, Dr. Jessica Shepard. Okay, frozen shoulder. So, one condition that often flies under the radar is frozen shoulder, and research shows it disproportionately affects perimenopause and postmenopausal women, but it remains undiagnosed and misunderstood. Why is this condition so prevalent among women in this demographic, and what are the latest treatments available?
Yeah, I love that you bring this up because this only signifies how much this perimenopause menopause transition impacts the rest of the body. So when we think of frozen shoulder, the funny thing is, I've heard so many patients over the years who have had this issue. And then when they go to their doctor, they're usually sent to an ortho. And, sometimes they're not getting diagnosed with that specifically. But frozen shoulder really is when you have like this adhesive type of capsule that forms around, the head of the biggest bone in the arm is the humerus. And what happens is it causes stiffness and limited movement in that area. But guess what? A lot of that has to do with the decline in estrogen, which is such a rich hormone in the sense that it brings blood flow to that area. And so when you have a decrease in estrogen, that's going to lead to a decrease in some of this blood flow and some of the lubrication in the joint. And therefore, you start to build like this capsule, which then freezes it, and you're not able to move and have that range of motion. And many women feel it like very suddenly, in a sense, not like overnight, but over the course of maybe a month, they're like, why am I having this issue in my shoulder? And I didn't necessarily have an injury, but now there's this limited range of motion. So the goal really is to identify it. So body awareness is always important. And the ways that we can really kind of treat this is thinking about hormone replacement therapy or menopause hormone therapy, and also some innovative ways that you can use shockwave therapy or even injection of PRP. So there really is a rich amount of treatments that can be done and not necessarily surgery. So the key thing is early diagnosis with self-awareness, and then looking at some of these other modalities that might be able to help, especially giving yourself back that estrogen.
Oh boy, I think I have this.
Me too.
Now, this condition sounds very debilitating, but it's encouraging to hear about these treatments that offer hope and relief for those areas. But I have to say, this sounds very familiar and very close to home. So thank you for putting an explanation. Yeah. Okay. So Lana, the science of skincare. So your brand has revolutionized skincare with carboxytherapy. While most people are familiar with products like retinol or hyaluronic acid, CO2 Lift takes a completely different approach. So what sets carboxytherapy apart in terms of results, and how does it benefit not just the face, but like we talked about, other areas of the body as well, vulva, vaginal, healing diabetic ulcers?
Yes. So, many people are familiar, and many of your listeners may be familiar with hyperbaric oxygen therapy, Well, that's what CO2 lift has been compared to, because it's going to increase blood supply, it's going to increase oxygenation. But I think what sets CO2 lift apart is the fact, like unlike hyperbaric, you can do it in the privacy of your home, but it's really putting your body in a position to start healing itself. And I think that's very important, because then you can regenerate your tissue. And along with the help of these other modalities that even Dr. Jessica mentioned, it's going to work along with them. But one of the things as we get older, hydration is important. The lack of it is seen in shriveled skin. You think of that grape raisin analogy that I like to use. The difference with a grape and a raisin is the water content. So CO2 lift, because it increases hydration 117% after one application, you're going to see that visible result in your skin. Another thing that I think is really crucial is elasticity. And we're talking about the face and neck, but we're also talking about our intimate areas as well. The elasticity increased 26% after only 6 applications. So that's, if you think of that bounce back in the skin, what's giving us that vibrant look in any part of our body, that's what the CO2 lift is doing. And we're talking about an aesthetic component, but there's also the medical component. Anything that requires blood flow, you can actually use it, or regeneration, you can use it. So it can be used in any part of the body.
Now, Dr. Daisy, cosmetic surgery and confidence. So, your work in cosmetic surgery goes beyond aesthetics. It's about empowering women to feel confident and whole. And in a society that often shames women for seeking cosmetic enhancements, how do you approach these conversations to ensure patients feel supported and respected?
Oh man, that's a loaded question. It always starts with listening to the patient. What is their story? Everyone comes to me with a story, and that story tells a lot about what's going on with them. And when I'm listening, I'm paying attention to the facial expression, their body language, and just other cues that are not in the actual words spoken. And that kind of gives me a feel of who this person is and why they want to do this and what do they expect. And from that conversation, listening to them, then I derive a plan. Ultimately, I always harken to the 3 pillars of why you should do this. Number 1 is your lifestyle. What is your lifestyle before you came to see me? It's very important, because a good lifestyle will give you great results. A poor lifestyle is not going to give you great results that's sustainable. So your lifestyle, we focus on nutrition. What is on your plate? I am a big avid of very intentional about what you eat and consume, because it's going to be reflective in your results and your sustainability. Then exercise. So this is a holistic approach. I really hound it on my patient, and I want that before I operate on you. And honestly, I'm known for turning down patients that I feel you don't have the lifestyle in place, because it's a combination thing. I call it kind of like a handshake contract, right? You expect me to do my best, and I'm going to give you my best. In return, I expect you to put in the work to give yourself the best. And that's outside of this office. And I feel like if we don't have that relationship, we don't have the understanding, then I am not the surgeon for you. So I think in some ways it holds patients accountable and is good. So with that said, society expectation and negative perception doesn't matter, because now we're focused on you, the person, and what results you want to have. And because I'm big on sustainability, longevity, it really boils down to what you do after my work is done.
It's refreshing to hear such a thoughtful perspective that really honors the emotional and psychological aspects of cosmetic care. So thank you for that, Dr. Daisy.
My pleasure.
Dr. Jessica, so holistic health in menopause. You advocate for a holistic approach to menopause, blending traditional and even alternative therapies. With more women seeking non-hormonal options, how can they strike the right balance between evidence-based medicine and holistic practices?
Yeah, I think that there's a way to beautifully blend both of those. And, as much as I'm a hormone advocate, and I realize that as we start to decline our hormones over the perimenopausal phase into then really having a really reduced amount in the menopausal phase, I find it important for women to understand what hormones mean. And if we're spending 40% of our lives in the postmenopausal phase, we're living longer, we're thriving, we're doing things into older age, you want to be able to do that with the best well span ever. So you want to be able to be in your 70s, 80s, and 90s and not be frail and not be weak and not, be able to kind of carry yourself around and do the daily things. So hormones really has an important part in how we look at longevity, but it doesn't necessarily necessarily mean that everyone wants to take it or can take it or wants to take it. So, in respect to that, is one, fully understanding what hormones are and all of them and how they benefit your entire body. But on the other side of it, I do think that there's so much space for other modalities. And when we think of that, that's going to be the non hormonal, whether it's with supplementation, whether you're doing holistic practices such as yoga, mindfulness, breath work, acupuncture, these all can be blended together. And I really think that it's not all one thing or the other. I think everyone's journey should be looking at both of them and how does this integrate with my individual self, but not only yourself, but your stages and phases. Because as you're maybe entering menopause at maybe 51, 52, your demands and your needs are going to change by the time you're 59, 60, and then again at 65 and 70. So this could never be looked at as just one thing that's going to work for the rest of your life. This really should be looked at as a beautiful journey. How is my body adapting to this? What's my mindset? And what are the things that I'm going to carry on throughout that journey that's going to change? This should really be looked at as I want to be able to look into all these different things and be open to the process so that you're not limiting yourself to just one way of doing something for the rest of your life. That sounds a little boring. I want to be
Yeah.
full of change and have different things and be open and curious. And I really do think that curiosity breeds growth.
Wow, that's great advice. It's a reminder that every woman's journey is unique, and having access to diverse options is key to making informed choices. And having access to providers like yourself makes all the difference. I know that you're rallying on social media and educating women one day at a time, and it doesn't go unnoticed.
Thank you.
Lana, let's talk empowerment through intimate health. So, intimate health is still a sensitive topic for many, yet your work with CO2 Lift is empowering women to prioritize themselves, piggybacking on off what Dr. Jessica just said. What feedback have you received from patients or clients that highlights the emotional impact of your treatment?
Well, first of all, I like the fact that, typically women think of self care as just face and neck. The CO2 lift, what we do is we bring our intimate life or intimate health into our self care. I'm feeling stressed. Let me put on a vulva vaginal mask. That's the kind of direction we want to lead women into. And the results of that are just been some great stories. I mean, you're thinking about bringing, first of all, taking care of this area puts it top of mind for women, making them think that, anticipating that it's going to feel good. And we're talking about sex and intercourse and making love. They're expecting it to feel good. They're expecting to get all the feels from this area of the body by taking care of it. And what we have done, and the feedback is, we're bringing back really a lot of relationships that were on the downtrend because of just lack of sexual intimacy, because it just didn't feel good for her. So now with this CO2 Lift V in particular, we're talking about, they're getting back into that area of their life and really initiating these type of acts with their partner. And it's really helping a lot of relationships. We're also, just in terms of that, even with younger women, I know we're focused on more and we're talking menopausal, but as Dr. Daisy said, this starts from in our 30s. But many women, even in their 30s, are just having babies. We've had some great results, even for women trying to conceive, and the benefit of taking care of this area of our body for them. So we have just stories upon stories of just feel good stories from women who have been using this, and I'm really, really proud to be a part of this.
Wow, you are a pioneer in female sexual wellness. I love it. And it's clear that this is about more than just physical results. It's about helping women reclaim their confidence and sense of self, which is so empowering. I love what you're doing, Lana. Well, that wraps up this enlightening conversation and menopause panel on women's health and wellness. I thank you all so much for coming on. Dr. Jessica Shepard, your book Generation M, without a doubt, is a must read for every woman. I thank you for being here.
Thank you.
Thank
Dr.
you.
Daisy, thank you so much for all your work. Your work bridges beauty, your work bridges health and empowerment. Definitely continue listening to her Polished Beauty podcast and check her out on the gram.